Hello everyone, I am Nurse Patience. Today we'll be talking about breast self-examination. Here in this video, I'll be telling you about how to do breast self-examination and the importance of this particular examination. Please, if you're a new subscriber on this YouTube channel, kindly hit the subscribe button. And if you are yet to subscribe, you're a returning viewer, please kindly do so to enable you get notification from us whenever a new video is up. Thank you. All right, welcome. Breast self-examination is one technique that allows individual to examine the breast and the breast tissue for any physical changes. And this can be done by anybody at your convenience. The reason why I'm giving you or bringing this to your notice is most people will feel it's only medical personnel or medical practitioners that are supposed to be doing breast self-examination. But this notion is very wrong because everyone should be able to do breast self examination at the comfort of their home. And breast self examination is not meant for only women. To correct this notion too, it is meant for both women and men because we both have breasts. It's just that one is more prominent than the other. Women have a more prominent mammary gland than that of the male counterpart. But for breast self examination, both the man and the woman needs to do it because breast cancer can occur in both man and woman. And the importance of this self breast examination is to help rule out any form of changes that can lead to breast cancer. And you would also need to know that if at the course of doing this breast self examination you find any lump, you need not to worry because studies have shown that over 80% of the lumps that are being found are non-cancerous. So please, you don't need to give yourself headache when you find a lump in your breast. All you need to do is go to the hospital to get further checks on those tissues now that is being found in the lump to be able to detect which is cancerous and the one that is not cancerous. Having said that, I would go straight to how you can do a breast self-examination. First, there are two ways to go about this. You can either do the first one, which is the inspection phase, and the other one, which is the touch examination. By the inspection phase, all you need to do is to use your eyes to visualize some of those changes that you can see. Those ones you can see with your eyes, with the visual senses. It's what the inspection phase of the breast self examination is all about. So with me in this video, I will not be able to carry a mirror because I'm standing in front of a camera. So if you are watching this video and you want to do a breast self examination, all you need to do is you stand in front of your mirror. Okay, standing in front of my mirror, I would first look at with my hands placed by the side. Like I told you earlier, this is to notice the physical changes in the breast and the breast tissue. So all I need to do in this inspection phase of the breast self examination is to check for any form of abnormalities that has to do with the skin, the size, the shape of the breast. So I'm standing in front of the mirror. First, you check with your hands by the side, just like you're standing at attention. Then you look at the breast. You look at the breast now through the mirror. You look at it for any form of abnormality. The next thing you do now is you raise your hand above your head. Okay, with this step by step approach I'm giving you, you should be able to do it on your own. So raising your hands up above your head, you are going to also check the breast and the surrounding tissue. Okay, doing it this way, the next one I'll do now is to put my hand on my hip, that's around my waist, and lean forward, still looking at the mirror if there's any changes. Now, what you need to notice in the physical face of this breast self examination is one, the shape of the breast. You would agree with me that in human, one of the breasts is usually bigger than the other. So, and mostly one is more pendulous. For those that have big breasts, one breast is more pendulous than the other. So you notice that there's a variation in shape, which is also very normal. But anything aside this, I'm going to give you the normal from the abnormal. Then you also check the skin. I'm still looking at the mirror. You too, if you are doing the breast self examination, you're also looking at the mirror. You check for any rash. If you find any rash around your breast, you take note of that, as you will be using this information to go visit your doctor for further confirmation of any form of deviation from the normal. Then you also check the redness. Is the skin around the breast red? You check for redness. Then you also check for this appearance we call orange peel appearance. When you see this orange peel appearance, example is you take the orange. When you peel the back of the orange, what it looks like, the breast is scaly, sort of. That's what we know called orange skin. And those dots on the back of the orange, the peels on it, that is a classic sign of what we are looking for in this physical examination. And once you see this, for most individuals that have breast cancer, orange peel appearance is usually one of the signs that they present with. And when you see this, you don't just keep quiet on it. You need to go see your doctor. So orange peel appearance is also one of the things you are looking on. Then you check for dimpling. Is the skin in any way squeezed? You check for puckering. If these signs are there, then you have passed this stage. If these signs are absent, you can be happy and you celebrate. But if you have any of those signs, you should take note of them and also book an appointment with your doctor. The next thing you do now is you'd also check the nipple. Okay, with my hand raised, I would also want to check the nipple. I'll just quickly check the nipple for redness. Still looking at the mirror, you check the nipple for redness. You check if there's any swelling. You check if there's scaling of the nipples. Then you also check if there's inversion. That's the nipple of a human is supposed to be pointed outwardly, but in a case where the nipple is now inwardly, it is pointed inwardly, that is an abnormality, and you should tell your doctor about. You shouldn't keep quiet about it. When you see this nipple inversion, you also take note of this. So with this, having said this, we've come to the end of the physical inspection phase of the breast self examination. The next step we'll be going to is the touch examination. I told you the breast self examination is divided into two parts: the physical inspection phase and the touch examination. So we've just finished with the inspection, which I said that you stand in front of the mirror. I'm just doing a recap. Standing in front of the mirror, you check the breast, the size, the color, the skin for redness, itchiness, the orange peel appearance. You check the nipple for discharge. You check for inversion of the nipple. You check for dimpling of the skin of the breast. You check for puckering. And if these are not there, you can move comfortably to the second stage, which is the touch stage. By this touch stage now, you'd be required to lie down. For the sake of this video, I will not be lying down because I don't have a model here. Neither do I have a mannequin that I can use to demonstrate this to you. So I will still be standing while demonstrating this to you. But lying down, I would be explaining to you and also demonstrating how you do it while lying down. So this second stage, which is the third examination, it should be done when you are lying down. By lying down, you lie down on your back. So by lying down on your back, you lie down facing the ceiling. Now I'm lying down facing the ceiling. Then my hand, this is my left hand, it will go around my neck this way. This is the way you place it. And for you to inspect or feel the breast tissue around of your left breast, you use your right hand. And the right hand you are using, you are not using your whole 5 fingers. You are using these 3 middle fingers. And by the 3 middle fingers, you will not be using these tips of your finger for the touch examination, because the results you will get with this will not be really accurate. So I'll be using the pad of my fingers, my 3 middle fingers, with my hands there. And when doing this the whole breast self-examination, ensure that you are naked. Ensure that you are not putting on bra and you are not putting on any form of clothes, so that you'll be able to get a very accurate result. So with these three hands, my three fingers, I will be going now. If I want to start my examination, the touch will be gentle. I will be gentle but very firm. So I'm pressing it this way, checking. Okay, okay. Look at the way I'm doing it. If I'm lying down, I'm going to do the same. Then when I get to the middle, close to where the nipple is, then I'll be using circular motion to check if there's any form of lump in it. If you find any form of lump in the breast, please do not be afraid. Like I told you, 80% of the lumps that are found in the breast is usually non-cancerous. So yours might be one of those lumps that are non-cancerous. So all you need to do is go get that tissue tested so that you confirm if it's cancerous or non-cancerous to enable you take measures. The same way you did for the left breast is the same way you do for the right breast. This time around, is this my right hand now that will be going underneath my shoulder? Remember, I told you for the touch examination should be done while you're lying down, and you don't use the tip of your fingers but rather your finger pads. This is the pad, this part is what you'll be using. And I said the touch should be firm and gentle. You don't rush, you take your time to do it. You can take at least 10 to 15 minutes, 10 minutes in doing this touch phase of the examination to enable you not to rush and get accurate results. Also, after you check the axilla, that's your armpits, because it's also part of your breast tissue. You check towards that side if there's any form of lump. Okay, you check for it, then you do the normal circular motion around where the nipple is, and you also press down firmly to see if there's a deviation from normal. After you've done that, you then gently squeeze the nipple. You squeeze your nipple to see if there's any discharge. If you are getting a bloody discharge from the nipple, it is you would also take note of that. Whatever color of nipple discharge you're getting, you take note of that so that you'll be able to relate with your doctor when you go for an appointment visit. This is very important. One thing, now I'll be giving you some things you shouldn't do before the breast self examination. Before you do a breast self examination, you are not expected to use lotion on your skin or on your hand to be able to do this examination. You do it on your dry skin and on your dry palms. So you don't need any lotion to do this. Also, when you are on your period, do not do breast self examination. Breast self examination should be done from the age of 18, because at 18, for most women, you are start seeing your menses. So at that point, it is very important to start doing breast self examination. For individuals, the category of people that can do breast self-examination, I told you, is both man and woman. That's both gender can do breast self-examination. But for women, if you are the type that if you are still seeing your menses, breast self-examination should be done 5 to 7 days before the commencement of your period. So you take note of that too before you do it. Then, if you are pregnant, if you are on your menopause, if your period is irregular and you have not started seeing your period, you pick a date in the month that you'd always use that date now to always check your breast, to check for any form of deviation or changes from the normal that you're supposed to get. I hope this video have been helpful to you. Like I told you, breast self-examination is very important. It's one major screening tool for breast cancer. We live in a society whereby there are so many women that have breast cancer developing, but they are unaware of it. The reason why I created this video is to create awareness about breast cancer. And if you are the type that don't do this, if you forget easily about doing this breast self-examination, you can quickly do it when you are about to take your shower, which is you bath every day. You bath every day, so breast self-examination should be something you do at least once in a month to be able to get acquainted with yourself, with your breast. With this, you know when it is normal and when it is not normal. So please, if you don't do it or you are finding it difficult to do breast self-examination, this video will be helpful to you. I didn't make this video just for those people who want to learn how to do breast self-examination. This video was also made for students, medical or nursing students who want to learn or are trying to read up to pass their exams, and OSCE exams too for the nurses who would need this as a procedure to be performed in the procedure station for them during their OSCE exam. So this will be very helpful to you. If you are yet to subscribe to this channel, like I said, kindly hit the subscribe button and also refer your friends to also come like this video. Drop a comment or two, I don't mind, and also invite others to come subscribe to this channel, and also you get a lot and lot of practical procedures from here, and you also get ample of knowledge that will be beneficial to both you, your family, and the world at large. Thank you for watching.